Every woman in their lifetime when they become menopausal will become estrogen deficient.
Dr. Shauna Johnston is the chair at the Division of Urogynecology and Reconstructive Pelvic Surgery at Queen's University in Kingston, Ontario. As a specialist in women's health, she is committed to empowering women to better manage their own health.
Without estrogen, there is less blood supply to the vagina, and the tissues repair more slowly and become thinner and more fragile. The vagina loses capacity and becomes stiffer and less elastic. That creates discomfort with intercourse.
Some of the symptoms of vaginal atrophy are discomfort during intercourse, include vaginal dryness and irritation, and sometimes recurrent urinary tract infection. Options for management include lifestyle modifications, non-hormonal treatment, vaginal lubricants or moisturizers, and hormonal treatments. According to Johnston, low-dose estrogen treatments vary in terms of patient preference and compliance.
I was offered local estrogen. I felt very comfortable with getting something that was going to relieve or hopefully relieve my discomfort, and actually it was successful.
Despite the availability of these treatment options, many women will not seek relief. One reason, according to Johnston, is an avoidance of the subject between the healthcare provider and patient.
I think the whole discussion is difficult because women aren't comfortable talking about intercourse, particularly with healthcare providers who aren't comfortable talking about intercourse and sexual function.
If they would initiate it, if they would ask you some questions that were more intimate, I think you then could easily respond to them.
In an effort to raise awareness about conditions of menopause like vaginal atrophy, the Big OW campaign is designed to provide accurate, evidence-based information and empower women to become more involved in their own health care.
I encourage all women to gather knowledge about what vaginal atrophy is by using resources like the Big OW campaign. And when they understand what the symptoms are and why they happen, seek help from a healthcare provider. Don't wait to be asked.
Thanks to the Big OW, more women are informed about their options. And as awareness of vaginal atrophy increases, Dr. Johnston is hopeful that fewer women will suffer in silence.
There is no reason that menopause should be a difficult phase of your life, that you can have help. Talk to your gynecologist. If she cannot help you or you do not get help from one, try another, okay? And talk to your friends because everyone goes through it.
For more information about vaginal atrophy, visit these websites.